and then over and covering every part. And, keeping in mind that a lot of times if you feel a little lump, it doesn't necessarily mean that it's cancer. There are hormonal fluctuations that women have, particularly, before they go through menopause, where sometimes you will feel a little bit more lumpy bumpy at certain parts of your cycle and then less so at others. But if there's something that's out of the normal for you, make sure another good plug for having a primary care doctor or an OBGYN that you see on a regular basis, because then if you do find something in your breast, you already have a healthcare provider that you've got a good relationship with who can then, carry on the rest of the investigation.
We found this to be particularly true after COVID, because during COVID, you had a lot of breast screening that wasn't being done because of the fact that we weren't doing routine screening. So you had women that it may have been 2 years since they had their mammogram, and they were coming with large masses.
Mhm.
So, that kind of underscored the importance of breast examination.
Yeah.
Also too, I mean, I defer, of course, to the doctors, but a lot of women of color are getting cancer younger, and it's before the mammogram guidelines. So by the time they get a mammogram, it's way advanced. So it's really, I suggest to everyone that I talk to, like, if you're Black with breasts, if you got boobs out there, you need to be doing breast self exams. Anybody with boobs, if you got a pair of boobs, do it. I'm talking to you with boobs. That's right. You know who you are.
Yep.
So
Dr. Renee,
too, that when we're talking about examining the breast, we're not talking about just the breast, but we're talking about the area of the neck here and up under the arm too, because the breast is shaped like a teardrop, so it goes up under the underarm, in the underarm area too. So making sure that we do that, and also that we look in the mirror. And that we're looking to see if there are any changes to the skin, any changes to the nipple, putting our hands on our hips and pressing in to see, so it flexes the chest wall muscle, that it stiffens the muscle behind the breast, so that you can see if there's anything that pulls too in the breast, on the breast skin, see if it's tethered in any way. Those are other things that we look for too.
Yeah, it's very important for people to please know your body. So look at yourself in the mirror naked and make sure you know, because if anything is there that wasn't there before, you need to let somebody know, because early detection is the best thing ever. I had a friend that was 31, I think it was, felt a lump, told the doctor. They said, "You're too young." Blew her off, and then when they finally did diagnose her, she was stage 3.
Yeah. I mean, if you feel a mass, I don't care what the mammogram or the MRI shows, like, go see the breast surgeon and have them look at it, because even if the mammogram is negative, because mammograms can be negative even when there's cancer, and somebody needs to put a needle in there. And then I think Dr. Jones can correct me, but after your cycle is the best time to examine your breasts.
Yes,
I think I might have said that already. I've been having connection problems.
But you mentioned it, but you are correct. The week after your cycle is the best time, because during your cycle, your breasts are more sensitive to hormones. So you can have a lumpier breast. You can have cysts that enlarge, that decrease after your cycle is over. And also, I want to make a plug for, if you feel something and you are pregnant, don't ignore it. Pregnant women get breast cancer too.
Yes. Yeah. So I was gonna say, I'm gonna ask Suzette this question, because you brought up the Dr. Renee brought up the point about being a cancer survivor. I have not, thank God, been a cancer survivor. I've had breast cancer scare. I've had a clip put in my breast, just like Dr. Renee. But I have been on this journey many times with my cancer patients the last 14 years. And one of the things that profoundly changes is their tolerance for BS, right? So after they've gone through breast cancer, they just don't have time for drama as much. Like, they try to hone in on what's important to them. They try not to let themselves get dragged down. Some people, it's easier said than done. There's always work drama. Sometimes the work drama doesn't get to them as much after they've had to fight for their life. I think it's very different to live with metastatic cancer than to live as a cancer person who's gone through early stage breast cancer treatment, but always it impacts mental health deeply. And the worst time is when the treatments are finished. People are so much more anxious because they're just waiting to make sure that they're not having recurrence, and trying to reconnect with their new body hormonal changes, like hormonal blocking can change your, I mean, talk to my friends who have physicians who are going through menopause, the anxiety, the hot flashes, the mood swings. And then we induce that in patients, sometimes some very young patients. And then they have more mental health issues, more problems like trying to find themselves. So I think it's very hard to be, especially a breast cancer survivor, because we treat breast cancer longer and harder than a lot of different cancers. We have the best survival in breast cancer, but we definitely overtreat a lot of women, and there's a lot of toxicity associated with the treatment, the scar tissue, even like, no offense to the plastic surgeons, there's very few reconstructions that look amazing, and there's not always a time and a place that it doesn't cause some anxiety when you get a deep flap and then the fat breaks down in your breast and it's actually fat necrosis and they think it's cancer recurrence, or the implant has flipped or leaked and somebody has to get that removed, or the expander's gotten infected. There's always some, it doesn't happen all the time, but there's some of that which complicates things even more, because everybody's hoping to have a smooth journey. They're not going to get neuropathy from their Taxol. They're not going to get a bad infection. They're not going to have their reconstruction retweaked over and over again. And it can be discouraging. So I think I'm just going to put a plug out there that, when you've seen your patients suffer through a lot to try to recapture their health, you're hoping that when they come out on the other side, that they're going to have this amazing life, that they're going to appreciate everything around. And I think they do, that they appreciate things on a lot deeper level, because it changes them, just like it changes us who treat cancer. We look at things differently too. We don't let things bother us as much because we know there could be worse out there. So it gives us perspective. But it's just, it's really hard to sort of, find, let life stresses like completely melt away. But I think that, people do look at life differently, do look at themselves differently. And you hate to see your patients go through hardship after they've gone through fighting for their life. Sometimes that is inevitable, but I think it's very important to work on physical health, mental health, get to a therapist, get to a psychiatrist if you need to. Don't be ashamed of taking anxiety medication or depression medication if you're having mood swings, because to live your life in a good place and where you see more good than bad, where you have more happiness and unhappiness, is the way you sort of win. Because I think Suzette made a point, like, I'm just gonna fight breast cancer and like just to go pay my bills. I mean, yes, but hopefully to like recapture your health so you can go on a trip, so you can go enjoy some weddings, so you can go, achieve your goals, run marathons again. If you need physical therapy to break up that scar tissue so you can straighten yourself out to go do the things you want to do it, So I think those things are important to remind people that even if you're living with metastatic cancer, for us, it brings us joy to see that our patients are having quality of life and they're still getting enjoyment out of life. They're able to push things in the background, push the cancer in the background, push themselves in the forefront, because it's always very stressful and very sad when you have a patient who lives in fear, lives in anxiety, and is not able to enjoy every moment and or at least enjoy more moments than being stressed out.
I totally agree. I say look for the happier sides of the journey. So I say I may have cancer, but at least I'm not on jury duty. You gotta look at the wins in life.
This is true. Were you a comedian before this?
I was an aspiring comedian, but I was more like a producer. I started an organization called NY Laughs, and we produce shows in parks throughout the city. But because of the disparity and that I felt like what the awareness campaigns that were out there. First of all, I thought like comedy is kind of my superpower. So I was like, well, why not try to put that to good use in this way? But also, I just also felt like maybe there needs to be a different tone in trying to just get the message out. It hasn't helped. Like I've been banging on doors and like, trying to get out there to get people to look at the disparity in a different way. Like, like we can fight this, we can do this. Like it doesn't have to be 40%. We can laugh through this. So it actually like sparked my material and my creativity comedically, but I still feel very much like an outlier. Like a lot of the other comedy world doesn't know how to take like jokes about breast cancer, but I'm like, it just all boils down to boobs in the end, right? It's just boobs.
Right.
October is a time when I just say like bad boob jokes for charity. It's about boobs in the end. If we can just talk about boobs, and maybe that'll help us get to the point where we can knock down the 40. Black women will know, like, you need to be on guard. You need to be vigilant. You need to talk about this.
Do you know my friend Michelle, the indie mom of comedy?
No, I haven't heard of it.
Okay, she's in New York too.
Okay.
Okay, yeah. But yeah, I think that your outlook on it is wonderful, and I think that Dr. Kotaya is correct. And I've always said it's called dis-ease for a reason. Dis-ease. So that's why you really do have to, I mean, as awful as it is, you have to figure out how to get a positive attitude so that you can turn things around and, and have a better outcome, God willing. So I think that, I love that your spirit, and I think that you're right. And every day people should be able to laugh about boobs, because this is something that, as you mentioned, is getting younger and younger Black women, unfortunately. And like you said, the mammograms, they have not changed the age. Colon cancer was getting people younger and younger, and they changed the age for colonoscopies, but they have not changed the age for mammograms just yet. And then I know I had a friend that was having trouble. She had a mammogram, but her doctor wanted her to have an MRI, I believe it was, and her insurance company refused. And she had to fight them tooth and nail. She did finally end up getting it, but how long did that, prolong her diagnosis? So it's just really, and then also I think that's the other thing with the patient navigators. I know as a caregiver myself, I was on the phone today for an hour with an insurance company. Not everyone has time to do that. And the patient that I'm caring for, my lovely father, he can't do that. He can't do that for himself. So that's why I thank God I was able to do that. But I think the patient navigators, that is amazing, because I bet you they do have all of that great information, the insurance companies and all of the ins and outs of all that stuff. It can be very helpful. And I just wonder, are those patient navigators available at these public hospitals that, like Suzette mentioned?
Well, I did my training at least at a public hospital in Miami at Jackson Memorial, and we certainly didn't have things like patient navigators. We didn't really have much support at all. I was my own nurse practitioner and scribe and secretary, and you do everything kind of on your own. So not having that support, it means that your time as a physician is kind of spent more doing non-physician things rather than kind of taking care of patients. And so having that complete team of support staff, it makes such a difference. I think, even if you're in a private hospital, in a insured situation, navigating the American healthcare system is really difficult.
It truly is.
Even for physicians ourselves, it's hard to navigate this system, and we understand it, let alone kind of by definition. Most patients that get a diagnosis of breast cancer, they don't know how to navigate any of the system. They're kind of just being thrown in trial by fire and trying to figure it out while they're also dealing with all of the stress and the physical, discomfort, and then on top of it trying to fight with an insurance company while you're feeling nauseous from chemo. It's so unfair that gets put on our patients. And so I think that's where having that family support, Dr. Renee, like what you're doing for your father, that there's just got to be that person designated in your family. This is the person who's going to come to my appointments and take notes about everything that was said, because maybe I've got chemo fog and I'm not really hearing everything that's being said. I can look at the notes later. Maybe that same person or somebody else can help me schedule all my appointments when the hospital's calling to schedule all these different things. Have a designated person who's got access to your calendar and can help you schedule, so that the things that you don't have to do yourself, someone else can help you with.
Yeah, it's so important. So important.
I was gonna say,
go ahead.
We are in a community-based hospital in Baltimore. When I started 14 years ago, we had one nurse for like 4 physicians. And the hospital has evolved over time to understand that having supportive care is very important for everybody. So at this moment, I have 2 nurse practitioners who work under me full time, and they field a ton of phone calls, labs, emails, because the patients email us a lot now. So probably sometimes like 100 messages a day. And we have 3 nurse navigators to help with getting drugs approved for insurance companies. My nurse practitioners help with peer-to-peers for like imaging that gets denied. One of the nurse navigators helps with FMLA paperwork and disability paperwork. I have 2 social workers who help with I mean, it's so important to have that team because
Mhm.
then you as the physician can focus on this is your treatment plan. This is I'm going to pull you through the treatment plan. These are the side effects I want you to be aware of. But having navigators is crucial, and we even have a separate patient navigator to help with transportation and to help with resources and connecting people with resources in the community. So I think navigators are making a huge difference for the patients and for us. And the breast center has a nurse navigator to help them through post-op stuff, pre-op stuff, getting them to physical therapy to get their measurements for their lymphedema and all that stuff. And then our navigators make sure the patients get plugged into the chemo infusion appointments, get plugged in to get their scans if we order them, get plugged in to see the radiation oncologist. They help us move with all these moving parts so that patients don't have to, if they get lost, they call the navigator and say, what am I supposed to be doing next? Or I'm having trouble getting my letrozole. They need a prior auth or something. Like they need a prior auth for the pain medication that the doctor ordered for me. They take all that off my plate. I mean, I cannot function without them. They really keep my work-life balance intact, and they really help the patients with these headaches that you're dealing with your father. It's really, I think it's very important to have navigators.
Very important.
It is exceptionally important. The navigator will come actually to my office to see our post-op patients. I will have introduced them when I talk to them and give them the diagnosis, and we talk about what the plan is and what the team is. The team always includes the nurse navigator. So I'm telling them about the nurse navigator, but I'm not necessarily meeting them at that section, at that session. But when they come for the post-op visit, the nurse navigator typically is at that session too, and then they can have a conversation also about and they will have already talked to them on the phone because for those that need to see an oncologist, they help to arrange all of that. But it is really, they are a really, really important part of the team. And as you were saying, Dr. Kataya, the other things, getting them with the testing, and also with other things like yoga classes, like other programs, Look Good, Feel Better. I mean, so many different other things that are of our benefit to our breast cancer patients. Also, for the support groups, one thing that Suzette was mentioning is that there are different types of support groups, because not all support groups are created equal for people at the same stage. So early stage breast cancer patients don't necessarily belong in the same support group as patients that are living with metastatic disease. So, or patients that are in a pre-op situation. So it is important to get people in the right kind of setting. One thing that we haven't sort of talked about, and perhaps Dr. Kataya or Dr. Dempsey could talk about, is cold cap.
Oh yeah.
Saving your hair. Drinking with hair.
Yeah, so cold capping is a really valuable tool that we have that can help to prevent hair loss during chemotherapy. Basically, the way that it works is you get a hat that's really kind of tightly affixed onto your scalp, and it's cooled because you don't need chemotherapy delivered to your scalp. And by cooling the scalp, the chemo doesn't get delivered there, and you can save your hair. Now, it kind of depends on which chemo regimen you're getting. The cold capping is more effective with certain chemo regimens than others. There are a few downsides. I mean, it does add on to your infusion time. There is usually an out-of-pocket cost associated. But if you've got the chance to save your hair, it may not look the same as your hair looked before chemo. You're not supposed to brush it real aggressively. You're not supposed to wear it back really tight. You'd wash it once a week if you're cold capping. So it may not look kind of as fabulous as it did pre-chemo, but helps it to grow back in stronger later and faster. And, a lot of these chemo regimens, up to 70% of women at the end of chemo that cold capped say that they feel like they can go out without a hat or a wig and nobody else can tell the difference. They can tell the difference, but that other people probably can't. And I just think, when we think about self-image, I mean, as women, our hair is important.
Mhm.
When you look in the mirror, you want to feel like you look like yourself. And so when
you look good, you feel good. That's
Of
what my
course.
mom said. So
And when you're dealing with all the rest of the impacts of cancer, then on top of it, having feeling like you look in the mirror, you're not yourself. Maybe with the steroids that gave Suzette all the energy, they can also give a little bit of, the chipmunk cheek kind of look, and then people have lost their hair, and that's really hard on body image. But I always tell people, all of this is temporary. Your hair is going to grow back, your face is going to go back to the way that it was. You're in it right now, but there's going to come a time where this is behind you and you're going to go back to your normal life.
Yeah.
And I do tell people that it might not work, like Dr. Dempsey says. The Taxotere chemo that we give is really hard on the hair. 7% of people will have permanent hair loss and it will never grow back again. And there were lawsuits about that in the past. And some people will grow back, but more like thinner, stringier, and some people will grow back fine. So, it's always worth trying, but it will cost money. It costs a few $100s, per month, I think. And not everybody can afford that. If you're getting a regimen like AC, which is Adriamycin cytoxin, followed by Taxol, the red devil drug, followed by Taxol, your hair's gonna grow back. So if you don't have the money for the cold caps, it's probably not a big deal. But, if you don't do the cold capping, after the first cycle of chemo, within 2 to 3 weeks, your hair will completely fall out. So, and that's a shock for people. It's not like it sheds slowly, gives you time to adjust. No, it completely goes. And it's on your pillow, so you have to cut your hair and then prepare for that so you don't inhale your hair. It is very traumatic, but I've had patients who tried it even on the Taxotere, and as long as they were doing what Dr. Dempsey said, where they're very gentle with the brushing, they're not washing it all the time, they've actually managed to retain their hair, which they never would have been able to do if they didn't do the cold capping. So it's worth looking into. And sometimes there's some grants that you can apply for to get it somewhat discounted. But, these are things that, we can try to do. It's because that was, I think, almost the most, it used to be nausea and vomiting. We've gotten much better. And now it's like, can I not try to loose my hair? So we're working on that too.
So, I'm talking about the advances though, in taking care of breast cancer, or even in diagnosing and treating breast cancer. Most breast cancer surgery is outpatient. That's one of the things people don't recognize. Most people aren't staying in the hospital at all for the surgery. So your diagnosis and your treatment may be completely outpatient, which is a really great thing. Or at most, it may be an overnight stay if we're doing reconstruction. So so there are several advances.
And that brings us to a great point. We're almost at the end, but clinical trials are so important, and that's why we've gotten all these advances, because we've had people participate in clinical trials. So if you have the opportunity, please participate in a clinical trial. They have clinical trials. There's a spot on the blackdoctor.org website where you can see if you qualify for any of the clinical trials, but there are several that specifically have to do with breast cancer. And I have a friend, touched breast cancer, Ricky Fairley, who has really been instrumental in finding Black women to participate in these clinical trials so that they can find, the best chemos that'll work for us, and all of that great stuff. So please, please, please participate in clinical trials, and don't think you have to be sick to participate in a clinical trial, because you do not have to be.
I did 2 clinical trials. One was aerobics, on the effect of aerobics on post-cancer treatment. So I got a free treadmill, and then I got an hour, I had a clinician on the other side. So basically it was a free treadmill and a personal therapy session for an hour. Woohoo!
That's awesome. And I bet you they paid you too, didn't they?
Not really. They didn't pay for that. They gave me a Fitbit or something like that. But yeah, I just wanted to leave my DNA,
But everyone, if you could, we'll start with Suzette, but I want to make sure everyone lets our audience know how they can find you in case they have other questions. So Suzette, go ahead.
Yeah, you can find me on Instagram, on social media under Strong Black Boobs. The hashtag, the strongblackboobs.com is my website. So yeah, so please follow me. I do all sorts of things, PSAs and stuff like that. So yeah, just please, I'm trying to save Black boobs, and opportunity to be on blackdoctor.org.
Thank you so much. Dr. Jones?
So I'm at Cynthia.Jones2 at atlantichealth.org.
Thank you. Dr. Dempsey?
My Twitter handle is at Naomi Dempsey. MD, or my email is naomi.dempsey@baptisthealth.net, and would always be happy to speak with anybody that was struggling or having questions or needed anything.
Thank you. And Dr. Kotaya?
I don't have a Twitter handle or TikTok or whatever. I do have an email. It's skataya@mdmercy.com. But I want to make a point that I think needs to be made. I don't know how Dr. Dempsey feels. There's not one of us who are medical oncologists who wouldn't love to give you some like sprinkle of like magic dust or like some apricot seed or some vitamin E to try to get you past your cancer. We would be the most popular oncologists in the world. Everybody would line up. We would be buying continents with how much money we made, right? So it's not that, I poo-poo on holistic medicine, but we try to be as evidence-based as possible. And if you want to do something integrative, like an acupuncture kind of thing, or like, do something to try to do in conjunction with what we have, great. But the reason we need clinical trials is we know that the response rates are not 100% to whatever we do. We would like for everybody to have a 100% cure rate. That doesn't always happen. Some people have tougher cancers than others. Some people respond to treatment, some people don't. So we always try to lay it out for you. If you have a triple negative breast cancer, chemo is probably going to be 70-80% effective. If you have an estrogen-driven breast cancer, it might be 30% effective, right? So maybe hormonal blocking will be better for you. But either way, if we can improve even on the standard of care, there's a good phase 3 trial. They offer it to you. You might respond better. You might not. You won't find out for years. You're doing it for the benefit of your community, and it might benefit you, but you don't know that at the time. And, you have to build trust. You have to sort of understand why you're doing it. But, it's important for us because the way, like you said, Dr. Renee, like the way we come up with the treatments today is because of clinical trials that were done, looking at treatment A versus treatment B to see what works the best and what's the least toxic thing. So we continue to try to evolve, like who can we admit treatment on? Who do we need to give more treatment in? Whose breast cancer is going to behave better, who's not? So we're trying to figure things out at the molecular level, come up with more tailored treatment, come up with smarter treatments. But the people who do the worst are the ones we always feel helpless because we felt like we could have done something else, but we don't know what. So research is very important for that.
Yeah, and the research has come so far. So please, if you can, participate in a clinical trial and make sure that you find a team that you trust. And maybe you need to get in touch with one of these ladies to find out if they know somebody in your area that you should go to because you liked what they said or something. I don't know, but we always say here at Black Doctor, do not wait to fire your doctor. You can fire your doctor. You have to make sure that they're listening to you and you're listening to them. And if for whatever reason, the way that they're speaking, you're not understanding and they're not understanding your questions, then you should find someone else because all of the diseases, not just cancer, are very important. You need to understand exactly what's going on and what you need to do. And when it comes to cancer treatments, you really need to understand exactly what you need to do, where you need to be, why you need to be there, what you have to do to be prepared for the treatment. So you really need to make certain that you and your doctor are on the same team and everybody is, trying to get to the same goal. Thank you, ladies, so much for your for all this great information this evening. And Suzette, you keep cracking us up and let us know where we can find you.
It's not just me; it's my boobs. I want to
go see you. Exactly. But yes, everyone, please go follow Strong Black Boobs. But thank you so much, doctors. You guys were fabulous, and everyone have a great evening.
Thank you.
Thanks for having us. I love your glasses, by the way.
Thank you.